The shoulder test report shows us specifically the range of motion of the joint in a different direction of movement and the relative speed of movement. In the upper row, we can see 3 rings that indicates the amplitude of the movement, while in the lower box, we have information relating to the speed of movement. In particular, in the ring on the left, we can see the rotation measurement. In the ring in the center, we can see the measurement relating to the flexion and extension. In the ring on the right, we can see the measurement relating to abduction and adduction. In each ring, we can view the measurement of the widest movement performed by the subject expressed in degrees. The normal range of the amplitude of movement weighted on the patient's age is also displayed. A color scale is displayed on the outside of the ring, where the green color represents the amplitude of the movement that falls within the optimal range. Orange if there's a slight restriction of the range of movement, red if the restriction is severe. For each direction of movement, it is possible to enter the relative value of visual analogic scale, with having the possibility to keep track of the patient's painful symptoms with a validated measurement tool. The visual analogic scale, it consists of a numerical scale from 0 to 10, where value 0 indicates no pain. The value 10 indicates maximum pain. The values between 1 and 9 inclusive indicates an increasing presence of pain. In the box below, we can see the average angular velocity measured in degrees per second in 3 directions of movement. In particular, we have speed of right rotation, left rotation, flexion, extension, abduction, and adduction, thus having available an important clinical parameters that allows us to evaluate the quality of movement. The range of movement measurement is particularly useful in the functional examination during the rehabilitation of shoulder trauma, disabling pathologies such as the degeneration of the rotator cuff structures, or during the evaluation of the patient with cervical problems. It is also particularly useful in the objective comparison of joint range of motion before and after the treatment, in highlighting changes in range of motion in different physiotherapy sessions, in comparing the range of motion of active and passive movement, or the amplitude of the gesture by performing corrective tests of the movement kinematics.